Ready? Don't stop the video. Okay. All right. Miss Karen, my name is Moses Momo. I'm the NP student, and I'm here to do HEENT assessment, which is the head, the eyes, the ear, the nose, and the throat assessment.
Okay.
This is going to be used for school purposes only, and I'll be sending this information to my instructor through YouTube.
Okay.
And I want you to give me a consent for us to do this.
Yes, you have my consent.
Thank you. So the first thing I'm going to do is to ask you, Miss Karen, how do you want me to actually call you?
Call me Karen.
Karen?
Mm-hmm.
All right. Now, Karen, I'll be starting with the head. Every inspection goes in that sequence of head, eyes, ear, nose, and throat.
Okay.
So we start with the head. You want to turn towards me a little bit?
Sure.
Okay. Now I'm going to check your head, the symmetrical of the head, to make sure that the head, I will check the symmetrical and contours of the head to make sure that nothing is abnormal, no lumps, no lesions, no swellings on the head.
Okay.
I will start with the frontal lobe area. I will check into the head and make sure that the head is okay. I will go to the occipital area and make sure that nothing is bumpy here. And I will also check the hair structures and in between the hair to make sure that there are no, check the scalp, the skull completely to make sure that you don't have any lesions in there. So inspection is over, and I will now check on frontal lobe, press it and find out any sinuses. Check here if there is any sinus area, any pain. Are you feeling any pain?
Mm-hmm.
This is the TMJ area, and I would like you to talk to me. Talk.
Okay.
Are you okay?
Yes, I'm fine.
Do you feel any pain there?
No.
Okay. Now we'll start with the eyes. And under the eyes, with the eyes, I will start with looking at the eyebrows, the eyelashes, the eyelids to make sure that they are all symmetrical. And you are fine, they are all symmetrical.
Okay.
The eyelashes, of course, you have a lot of eyelashes, which is good. Now I'll be checking on the peripheral vision of your eyes by doing the supra and the posterior checks. And when I come with my finger, you tell me where will I stop when you'll be able to see my fingers coming.
Okay. Stop.
Okay. And I will start again from this side.
Stop.
Okay. So your peripheral vision is good. Okay. And there's also another way I will check for peripheral vision. I will come from your back, looking from the 180 degrees, so you're looking straight forward. And when I come, you see me?
I see you.
Okay. And I will start on the other side too. If you can see me coming from that side.
I see you.
Okay. So that's the peripheral vision. That means you have a very good peripheral vision. In every eye structure, we have the sclera, which I'll be checking your sclera to make sure that it's okay. There is no conjunctivitis. So I'll be checking in the conjunctiva area, and also I will check if there is any accommodation process, and I will check for the near test of the eye,
Okay.
making sure that the eyes constrict or they diverge within the time frame. So, okay, they are pink, and that is expected of every eye structure. I will look at the sclera. If the sclera is clear, that's good. And I will now check on the eye. I will look at, if I want to look at the right eye, I will close my left eye and put the otoscope on my right eye and bring it towards your right eye. And the left eye should constrict.
Okay.
And when I go to the left eye, I will do the same thing, and your right eye is going to constrict.
Okay.
Right or right. And when I look at the eye, I'm looking for the red reflexes. And when I see the red reflex, I will go straight. I will hold the head and go straight with my fingers like that. And the reason why I'm doing that is because I don't want to see any like bump to bump. And that's one reason why I'm doing that. Okay, so I'll take care of that in that case. And I will look at the eye again on the other side. Okay, so that means your eyes are constricting very well. I will also do a test of the near. When I bring my finger closer to you, I want you to look straight to this finger.
Okay.
And I'll bring it closer, and that's the near test. And as I come closer, the eye is going to constrict.
Okay.
And when I move it, I want you to look far away, and you see the pupil will enlarge. So the pupil converges and it enlarges as I move away from you.
Okay.
Okay. So that's, your eyes are really very good. I didn't see any redness. I look at the optic. I look at the optic now when I was checking, and I look at the macula, and I also look at the fovea while I was doing that test, and everything is in place. It's working well.
Okay, good.
Now we come to the ears. On the ears, I will look at the ear, the outer part, which is called the outer ear here. In that outer ear, we have cartilages and bones. And inside the ear, we have the auricle. And from the auricle to the inside, we have the tympanic membrane, which is the eardrum. So I'm checking if there's any inflammation, any redness in the ear, and I will check that. And when I'm looking into the eardrum, I will pull back and up.
Okay.
If it is a child, I will pull back and down. If it's a child. And I'm checking for any inflammation in here. I'm checking if there's any redness. I'm checking for any wax accumulations. And I'm checking if any damage done in the eardrum area, which I see there is very good. Everything is fine there. I have to check on the other side. Whatever I do on the right, I have to do on the left. I pull, check that inside, and making sure that everything is good there. No inflammation, no redness, any pain?
No.
And all this here, the outer ear is all good.
Okay.
That's the ear test. Now I come to the nose. The nose, I'm going to look, because everything is inspection first in every test. So I look at the nose to see if there's any symmetrical value. And now I look at the nose, it is very symmetrical. The right is equal to the left. Now I will look at the bone here and the cartilage here. Any pain here?
No.
Any pain here?
No.
So the sinuses are all good on the outside. Now I check from the inside. And I want you to put your head up for me. I'll close one side. Look in. Any redness? No. I will check for septum deviation. The septum there, it's okay. The nasal septum is good. There is no differences there. It's all symmetrical.
Okay.
Now we come to the throat. In the throat, we are going through the outside. We're looking at the outside, and we're looking at the inside. So now that we're looking at the outside, which is going to be the throat, I will start feelings of the TMJ bone areas again. Go down here. See, checking for any lumps, checking for any swellings, checking for any trachea deviations. There's no trachea deviations here. Checking here whether everything is fine. Checking for the thyroid glands. I'm looking for any swellings in the thyroid, and I will tell you to swallow. Can you swallow some spit there? Okay, so there is no extra swelling in the thyroid area. Now, after that, I will also look at the mouth, and in that mouth, I'm looking at the soft palate and the hard palate area. I will check for the tonsils. I will check for the dentitions. I will check for the tongue and the structures in there if there's any inflammation of the gum and so forth. So I'm going to do that. Do you allow me to go ahead to do that?
Yes.
In that case, I'll be using my gloves now this time. Oh my God. Oh. Yeah. I brought the wrong gloves. Okay. I'm sorry, I should have used my gloves right now, but the gloves are so small for me. So
Okay.
I am going to use my sanitizers again. And I want you to open your mouth for me. And I'll be checking the upper palate, the dentition. You have some implants, right? What do you have?
Lot of cavities.
Cavities? Okay. All right. I want you to raise your tongue for me. And I'm looking at the soft palates, and the hard palates will be over there, far away. Now, I want you to just say ah for me. Ah. Okay, I'm checking for the tonsils and making sure that everything is good. No inflammation, no redness, no swellings, nothing. No tonsils. You already removed your tonsils, right? Yeah, I didn't get that too well. So there. So that's why I was trying to ask you that. But I didn't want to. When did you remove your tonsils?
16.
16. At the age of 16? So do you know, did they ever tell you the name for that process?
Besides calling it a tonsillectomy? No.
Yes, tonsillectomy, correct? That's good. At the age of 16, you had a tonsillectomy. Was there any infection after that?
No.
No? Okay. Is there any other question, any other thing that you want me to know from this test?
No.
Okay.
Okay.
Are you comfortable?
Yes.
No other questions for me? Okay.
Okay.
I want to think about maybe I want you to move your head for me to the right and to the left and down and up. Any pain so far?
No.
No pain. Okay. Thank you very much, Ms.
You're
Carey.
welcome.
Thank you. If you have any questions, don't hesitate to ask.
Okay,
All right.
thank you.
Bye for now.
Bye.